This fall, producer Sarah Gustavus and correspondent Antonia Gonzales have taken us to Native American communities in the Southwest to learn how people are improving their own health and wellness and sharing what they've learned with others. How do you get inspiration and learn new strategies when it comes to your health? If you said go to Google, you're not alone. This week we'll learn how some Native Americans are using apps and online tools to pursue a healthier lifestyle.
If you search online for how to improve your health, you would find thousands of websites and articles. Same for health apps on your phone. But not many of them speak to the experiences and values of Native American and Alaska Native people.
When a lot of people hear the words wellness, they automatically think of physical fitness. And a lot of times we will forget about the other aspects of wellness, which would include social aspects, mental, spiritual, emotional.
United National Indian Tribal Youth, or UNITY, launched the Wellness Warriors app in 2017. Like other apps, it asks users to track health outcomes.
In our app, there's two different trackers. There's a fitness tracker, which can allow you to do walking and running, as well as a wellness tracker.
But the Wellness Warriors app also measures relationships and mental health. That's an important point because the suicide rate for Native youth is higher than other ethnic groups.
You don't feel great physically every day, but you also don't feel the same socially, mentally. So every day you're essentially a different person. The wellness tracker is set up in 4 directions on a sliding scale, and it'll track daily so you can see each of those aspects on a different color, on a color graph.
The goal is to get users to reflect on how they rate various aspects of their wellness over time so they can identify areas that need more attention. The app was designed based on feedback from tribal youth groups across the United States, says coordinator Lauren Ashley Buford.
We heard time and time again that youth were really interested in a new approach to wellness. We really wanted to create something that was representative of who they are currently, but also who they want to be in the future.
Buford says one of the challenges was building an app that could measure outcomes beyond weight loss. Native youth are more likely to be overweight or obese than other groups in the United States. But an Indigenous perspective on wellness is not just about physical health. Mental and spiritual health are equally important.
Traditional teachings, they weren't meant to be quantified or to say this is success. Our elders and our traditional people knew that this way of life was the most successful way to be, and you could feel that when you were living in true balance.
And health providers like Dr. John Molina are paying attention to how their patients are using online tools. He says apps and online groups provide new opportunities to promote something he's seen in decades of experience in healthcare. That lessons from other patients can help people make real changes.
I was reading a recent study where it shows that even among ethnic minorities, whether they're African American, Hispanic, or American Indian, the usage of technology and apps are far more than the general Anglo population. And I believe that's going to be another area that we can focus on to ensure that we can get information to our people. How did it go with the fundraiser? Was everything okay?
I believe so.
The thing I've learned in medicine is sometimes people tend to learn better off of each other. Like, what worked for you? What did you do to control your diabetes? Or what did you do to control your weight? These are things that people can learn from each other, I think, that are very encouraging and really are able to support that way of people helping each other.
Personal trainer Waylon Pahona has also seen this in his work for himself and clients. Pahona was once overweight and not just carrying extra pounds, but heavy emotional burdens.
I was sexually abused at 9, seen my father accidentally kill a 3-year-old child, and then I also had to revive my mom when she attempted suicide.
Pahona decided in 2012 that others might benefit from sharing how their past affects their health today. He created an online group, Healthy Active Natives, on Facebook. There are currently nearly 69,000 members. It's a space for people to talk about what's holding them back from living a healthy life and see they're not alone.
One day somebody shared their story of alcoholism, another person shared their story of domestic violence, and so all of those issues finally started to come out in people, and people started to follow with what they were seeing. They thought, wow, this is really amazing that people have overcome all of these struggles, because I'm also going through these struggles.
Pahona and a team of volunteer moderators approve requests to join the group and make sure people are offering support and not selling products or giving out medical advice. He says they've seen people form connections offline too. People have met because of Healthy Active Natives. They've traveled to different states to run marathons. They've created friendships. This isn't a dating site either, but some people have actually met their partners on the group. So it's done a lot of things in a positive way to make changes in Native communities. The team that created the Wellness Warriors app says online connections are an opportunity to share stories and challenges, but building relationships offline is also important in pursuing better health.
It's a good support system to get together and exercise. That's why kids go to the basketball court and play basketball. I mean, you hardly find anybody to go play by themselves, but their friends are there and they're playing. You get a physical and social interaction there. And right there, you're already hitting two parts of your wellness.
And Dr. Molina sees the potential in combining the tools of today with the knowledge being passed down by tribal elders.
The thing that I'm really encouraged about is that a lot of our young people are going back to our ancestral ways of life. And they're the ones that are going to integrate the ancestral way of life to the Western way of life, and are going to be able to walk in two worlds. And they're the ones that are going to really begin to make those leaps and bounds for our people to improve our health care, to improve the way we live.
For New Mexico in Focus, I'm Antonia Gonzales.